Thank you very much. I would like to first say that I'm very honored as a Mexican in CEPAL to be here. I'm very happy, honored. Thank you very much for Mexico for giving us the opportunity to do this work that we do with a very good disposition because we believe CELAC can support us and we can support CELAC. We can provide the resources and know-how to the Latin American and Caribbean state CELAC. I'm going to tell you why this plan is very important. Firstly, as it was stated by Mr. Chancellor, the truth is that our region won't vaccinate 80% of its populations at this pace that we have. Only some countries, and I'm presenting a chart of the vaccination of people from more than 15 years. There's a difference between this chart and the chart that will be published today, later this day. What this shows us is that we have a problem in Latin America and the Caribbean because we have 3 or 4 countries that have more than 80% of their population vaccinated, and we have an average of countries that have more than 45%, among them Mexico. But we have another group of countries that don't even have 10%. I can even mention the case of Haiti. It's urgent. That's why we have this plan today and presenting action and short-term actions that are precisely to be able to buy vaccines as soon as possible, and the countries that already reach agreements can have access to joint purchases of vaccines. And Mexico have done a lot, and it's being explained. Mexico has donated vaccines to Central America countries. For example, Paraguay didn't have regulatory agencies and depended on COVAX. But in the region, we have the capacities. And this is what shows this document, the capacities that the region has today to produce its own vaccines. So what have we have to do in order to achieve that? The first action we are proposing is a short-term actions, and it's an easy task, is how to join together these 6 regulatory institutions to join together so they can work together and recognize each other and work in favor of our society. Because if we don't recognize ourselves in the regions, we will not advance. Something that what happened in Paraguay, COFEPRIS recognized one vaccines, and if, for example, AMAT, the Argentinian agency, can establish regulatory agreement among COFETIC, AMAT, Brazil, and VISA in Chile, the Institute of Public Health, Mexico and Colombia. These are the 6 countries. These are short-term actions, something that we can do with political will that was shown by the countries. We started the dialogue, and it's something that should be This is the first step that we can take to establish this, to achieve these goals. And the second plan is to have a clinical trial platforms, and we already have who are the sponsors of these clinical trials. We have seen which universities, laboratories. You already know about people who have been part of the clinical trials from all of the ages. Our regions has already given their arms for clinical trials, but now we need a collective action so as to establish a network to establish our clinical trials, our own clinical trials. They need us. They need us to abroad. We have identified 125 sponsors from the 11 countries as for starters. So we have to develop networks for the different phases of clinical trials, and these universities that are already carrying out clinical trials in Brazil, Chile, Mexico, Argentina, we have to establish a network to make it easy to have access to vaccines with better prices and very conditions. This is key. Also, we have to see how we can achieve these public purchases, how to have access to the practice, so there's no inequality. So we have asked the countries to name a special commissioner to work with us. We have established our network of 20 experts in the regions, and we want the participation of the different countries because we want not only our own vaccines, not only the molecule, just the vaccines, but we also need the alcohol and all the supplies. We need also supplies, and it represented an obstacle during this pandemic. So we need to improve our capacity. The fourth action is how to strengthen productive consortium. Mexico and Argentina already were an example with AstraZeneca. They created a production consortium. We know that Sinovac want to open a plant institution in Colombia. We know that in Mexico, Cancino wants to is already operating in Mexico. We know we have to see how we strengthen these consortiums. So what we need, we identify the document. What are the industrial actors that have to be on the table and to sit with us? We have identified the participation of national and international laboratories, industries that are representing global pharmaceutical industries, that we want them to be and to talk with us. We need agreements. We need a committee of scientific experts. In Mexico, for example, we have the privilege of working the director of
y él me decía, vengan y se sientan conmigo para que yo les ayude con la OMC, con la Organización Mundial de Comercio, y veamos, porque esto ya lo están haciendo para África, para 5 países de África, bueno, nosotros queremos que lo hagan con nosotros también, ¿no? Queremos que nos den esas licencias temporales y de algunas obligaciones. Y por último, yo creo que el objetivo final,
I believe that our final objective, well, not final objective, but one of our main goals is to understand the how complex health is. It means the manufacturing industry, the research industry, the production, and how we articulate all of these with demand. Because remember that we have the offer, which is production, and the demand, that are the hospitals, health systems, primary assistance institutions, and these documents provide a vision of the primary assistance. We need health prevention for the communities. That is something that this pandemic have uh, taught us. We also see made an analysis of what is happening in our health institution, health system in our countries. People don't have primary assistance, universal health care. Some countries we have people that it costs 56% of their income in of their money, and in Europe they have a amount 20% of their income because they have universal health care.
Obviamente cotizan en bolsa las farmacéuticas, son muy importantes, pero las que producen medicamentos en América Latina y el Caribe
The
solo
ones that
representan
produce
el 8%.
medicine in Latin America and the Caribbean represent 80%, but most of the companies that provide medical assistance are the private institutions.
Entonces, ¿cómo equilibramos? Queremos producir.
We want to produce not only to.
Queremos que la región pueda
We want
producir.
our region
Y
to
también
be
un poco
able
el
to
peso a los
produce and to
hogares,
take
sus costos.
uh,
En este momento, afortunadamente, todos los países han puesto las
to
vacunas
take
a
the
disposición
responsibility
gratuita.
to the individuals.
Eso es
Thankfully,
un
we
paso
have
importantísimo
gained
porque
access
para que
to
sea la vacuna
vaccines
universal tiene que
to
ser gratuita
give
y por supuesto de calidad.
our
Así es que
population free
yo me podría
vaccinations.
quedar
This is
todo el
very
día hablando
important.
de
I
esto,
could
¿verdad?
stay
Pero
here
lo que les quiero decir
the
es
whole
que sí se
day,
puede.
but
Tenemos
my
las
main
capacidades,
goal is to tell
podemos
you that
hacerlo,
yes, we
pero hay
can,
que
we
tomar
have the
acciones
possibilities, the
rápidas,
capabilities,
concretas,
but we
y
have to
creo que hoy
take
CELAC nos ha dado
bold
un potente
actions, and I
mensaje.
think
Así
CELAC
que
have
canciller,
given
nosotros nos
us
ponemos a la
an
orden.
important
Y ya,
message.
para terminar, quiero también decirles que
And I
trajimos
want
otro
to
documento, ¿verdad?
tell you we
Miren,
have another
con 5
document
propuestas
that
concretas para el
shows
financiamiento del
5
desarrollo. En donde estamos,
proposals
nos lo
for
pidió Costa Rica,
financings.
que preside
That's
nuestra
something
CELAC,
that
nos
was asked
pidió
by
que
Costa
acá hay
Rica.
una agenda innovadora de financiamiento con 5
Here I
elementos que
have
se
an
vinculan
agenda
también a
with
las
5
vacunas y al
elements
fondo
that
de
are linked
desastre,
to
porque una de ellas es
vaccination
más
and
liquidez
disaster
y que
management
estos derechos
funds.
especiales de
And one
giro
of
se
these
distribuyan
proposals
mejor
is
y a los que
more
les sobra, que les
liquidity.
sobran muchos derechos especiales de giro a los desarrollados, pues también nos los manden para acá. Segundo, que se establezca un fondo
Oh,
de
and
capitalización
second,
en
the
la banca
establishment
de
of
desarrollo, pero
capitalization
no solo una
fund
banca
in the developing
regional
banking
o global,
industry, not
la
only
nacional también.
here
La banca
in
nacional actúa
regionally,
un
but
papel muy
also
importante,
national
por ejemplo, la
banking
BID
systems.
o otras bancas nacionales. Y el tercero es este
Thirdly,
fondo de
this
desastres, cómo actuamos frente a
disaster
a
fund,
crear
how we
resiliencia y frente a este fondo
to
de
establish
desastres. Señor canciller,
resilience.
muchas gracias. Nos han dado
Thank you very
la
much,
dificilísima tarea de
Chancellor